Welcome to The Women's Wisdom, our journey in emergency medicine podcast, a production of the Women in Emergency Medicine section of the American Academy of Emergency Medicine. Join Doctors Molly Estes and Liz Calhoun as they are joined by prominent women in emergency medicine and other special guests.
Hello, everyone, and welcome to this episode of the Women's Wisdom podcast. My name is Molly Estes. I'm clinical faculty at Northwestern University in Chicago.
And my name is Liz Calhoun. I am an attending physician at Mercy Fitzgerald Hospital in Darby, Pennsylvania.
And we are very pleased to welcome to our episode today a very special guest, Dr. Megan Stobart-Gallagher. Megan, welcome to the episode. Tell us more about yourself.
Oh, thanks. I'm very special. It's very exciting to be special on your podcast. I am Megan Stobart-Gallagher. I am currently a residency program director at Jefferson Einstein Montgomery Hospital, just outside of Philadelphia. Yeah, I don't know. I'm a mom of 3. I'm crazy busy, and I'm really excited after rescheduling this like 3 times that we were able to get together and do this today.
I know, commentary on the emergency medicine physician's life right there. One of the interesting things about recording a podcast is that the episodes never come out on the day that they're recorded. And so we very rarely make reference to time when we're doing our recordings. But today's actually a pretty special day. Today is October 1st. And for any of our listeners out there, today is the day that residency applications get released to programs, which is this really interesting, critical point in application season. This is when all of the tension for all of our applicants out there reach their height. Their application, the blood, sweat, and tears of the last 3.5+ years of their lives, taking into account everything that they did pre-medical school too, is now out there in the world on display. And every single program is equally anxious. They are combing through hundreds of applications, trying to find that mix of individuals who are going to be the future of their program. No pressure, Megan. But I think that it's really a cool point in time because in this moment of time, we can really find crystallized some of the essence of why we decided to do emergency medicine in the first place, and take this as a moment of reflection back to why we continue to decide to do emergency medicine every single day into the future of our careers. So, taking this point of reflection, Megan, why'd you decide to do emergency medicine?
Oh my God. I feel like I'm going to have that cliche answer that we don't want the applicants to tell us on interview day where I liked everything. So I went into medical school thinking pediatrics, and then I did my pediatrics rotation, and it was fine. And then I did like trauma and surgery, and I was like hooked. I wanted to be a trauma surgeon. Then I was like, I'm going to be a pediatric surgeon. And looking back, I was insane. I had completely lost my mind thinking about those things. But I was really lucky that at the very end of my 3rd year in May, I did an EM rotation. And it was like the culmination of all the world just made sense in an elevator. Like, people talk about having a moment. I had left a shift super late. It had been a crazy day in New Jersey. I was in New Jersey doing my clinical rotations, and I was just like, what am I doing? And it was a different time. But if students right now are listening and they could imagine what it's like to decide in May to change your specialty and have no rotation set up and have nothing, it was a bit of a whirlwind, but I never looked back. And it was such a great decision. Emergency medicine is about people, and it's about the people that you work with, the people that you get to take care of, the stories. And yeah, the procedures are great. The resuscitations are fun, but it's really just about people. And I think that was more of why I chose it over a more surgical specialty or something along those lines.
So you make the decision to change into emergency medicine. You get into residency. You successfully complete residency. And as we were just talking about, I'm the non-academic on the podcast, but yet you chose a career in academics. How did you get there from being the girl that last minute changed specialties and wanted to be a trauma surgeon to I'm going to go into academics?
I had a great mentor who directed me this way. To be honest, I was the same person in residency as was in a student. I was like, I like this, I want that. Maybe I'll do a fellowship. You mean? And of course, it was like, I want to do critical care and do all these exciting things. I became a mom in residency, and I think that gave me a different perspective on where I wanted my career to go versus where I wanted to stay. And people saw more in me than I knew was there in regards to teaching and organization. And so I stayed at the program where I trained. I trained at Einstein Philadelphia, and I stayed there as a new faculty member and became the clerkship director. And after spending a few years with medical students, it really solidified for me that molding and helping the next generation figure it out and get there and see emergency medicine the way I see it really set me on this path. And to be really honest, I said yes a whole lot, and maybe I should have thought about it a little bit more before I said yes. But I think that if I had said no, who knows, I could certainly have not had the longevity that I've had so far, and certainly not the career trajectory that I've had.
Nobody on this call has ever had a problem in saying yes to too many things. Absolutely not.
No, not us.
So guilty. I met with my chair yesterday about it was our annual mentoring meeting, and she's, so what are your next steps after program director? And I was like, I don't know. A bunch of people have asked me to do committee things and institutional stuff, and I just keep saying yes, and I probably should stop. So it's just a problem that we have sometimes.
So, of course, along the way, nothing is ever as easy as we sum it up to be. There are always highs and lows in the journey. We trauma bond and celebrate success along the way. And one of the things that I think is so valuable in a moment of reflection is being able to look back at some of those moments when things went horrifically wrong and yet turned out okay, as well as some of the moments where surprisingly surprising success happened as well. And so, if you were to reflect back, what might be some of those moments that stand out in your mind? Something that maybe in the moment seemed like it wasn't going as planned, but ended up being a good thing? Or something that was not planned at all, but ended up being like one of the best things that could have happened to you?
It's so funny. As you were talking, I was like starting to see like flashes of patient cases and like experiences or like arguments with consultants. And then at the very end, I was like, this is the easiest answer ever. It was my daughter, my first daughter.
Oh my
Yeah.
gosh. Aw.
Yeah, I mean, you don't, and a lot of people plan to get pregnant during residency. I did not. And Joanna or Joey, she's currently 13 now. She's turned 13. I call her my serendipity. She was this amazing accident that turned into the best thing in my entire life. And managing that in the middle of residency, like just the emotional roller coaster of not only physical stress, emotional stress, things like that. She gave me kind of the reason to sleep more or take better care of myself or find, the non-existent thing that is balance. But yeah, she was the most unexpected thing and definitely the best thing that has ever happened. I certainly could talk more about specific EM things, but she is my thing.
We talk a lot about happy accidents on this podcast, and I think you have been crowned the winner of the best all-time happy accident.
You know what? I will give Joey that crown. I don't think I need to wear it.
Yeah, seriously, especially going into interview season, that's a pretty good interview answer. Well done. Strong work.
Thank you. I practiced a little bit.
So then how when faced with this left turn of life, huge left turn of life, wonderful left turn of life, right? How you mentioned that it forced you to reevaluate. It forced you to actually a lot of ways take better care of yourself. How did that lend you different perspective, perhaps, on your medical career as well, beyond just the change in balance between your personal life and your professional life?
Oh gosh, I can probably think of two answers. The first was already what we alluded to, just made me realize I had been on this path for a really long time. Like I didn't get into medical school the first time, tried again, got in, did get into my residency, but it was like the only goal I'd had for such a long time was to be a physician. and to be successful. And it was just so career minded. And I feel like when you look back over those, I don't know, 8, 12 years of your life where you're like high school, college, med school, this whole period, you're working and you just have this one goal, right? Like I was waitressing, I was doing lab work, I was trying to make money, right? And then I'm like, I'm going to be a doctor, I'm going to be this critical care doctor. And then this left turn is, oh God, there's so much more. Like slowing down and just seeing the world around you, and also just appreciating kind of what else is out there, whether it's, staying home, going home early instead of staying in the office, going in late because you wanted to take them to school one day. It just gave me another goal, which has been really nice.
I want to explore this more because I think this is something that we don't talk a lot about is being a mom in residency and family planning. And even though Joey was not super expected, she obviously had a great impact in your life. And now you have 3 kids. How did you go about finding balance that you're talking about, making those decisions to go in late to work, leave early, take time for yourself and your family while juggling a demanding and progressing career?
The first thing I think is just to accept that it's going to be really hard. And I will be honest and say that took me a long time to realize that. When I first told people, whether it was leaders or mentors or things like that, there's always like this nidus, right? That pushes you, whether it's like taking you 100 miles an hour at work or at home. But someone told me that I was going to have to choose between being a good mom and being a good physician. And I was like 20 weeks pregnant, right? And I've always been this like super motivated person. And I just remember like my jaw dropping and being like, what? And immediately something triggered in me to be like, I'm going to prove you wrong and I'm going to do it all and I'm going to be great at everything. And I can tell you
Because
that
that's not emergency medicine in any way, shape, or form.
I could curse on this podcast. I would. I was kind of like, I'm going to prove you wrong. I probably was crying at the time, however, because hormones. But I just remember being shocked that another person who was a mom and a physician would say that to me. And it's taken me a really long time to come to the realization that she was probably looking out for me. She probably wasn't telling me I couldn't do it all, but I think it was their way of probably not the best terms or words used to say that you need to find balance, you need to prioritize. It was hard. I screwed it up. I still screw it up many times, but I don't know which turn we're going here with this. But after my second child, I did have postpartum depression. And I'm very happy to talk about that because it is underrecognized and underappreciated. And women in this country and around the world do not have enough support. And we don't have to go all that way. But I still tried to hide it. I tried to hide it from everyone I worked with, my husband, my kids, because I still felt that I had to be good. I had to be better. I had to be good. I couldn't slow down. And then I got help. My husband forced me to. He told me to get my shit together, which was a man who does not speak to me like that, told me that I needed to do just that. And so when it came time for my third child, I went into like my OB's office. This is what I'm scared about. This is how I got better, but I want someone to watch me and look out for me. And I would love to say that it was perfect. It was anything but. It was even harder than the second time. But I think so Mason is 4 now. So I have Joey, who is 13, Ellie, who is 9, and Mason, who is 4. And finally, after Mason, where I really struggled a lot, I slowed down. I'm sorry to say that it took me that long, but my life was color-coded planners and Post-its and killing myself to be a great mom and a great physician. It's still so hard. But I will tell you that I stayed home from work today so I could do a bunch of stuff for the kids. But I also scheduled this. I'm so happy that I'm doing this now. But before this, I took time for myself and I rode my Peloton and I had some tea. And it was like the best 45 minutes of the day until now. I might pay for it later, but you know what? I needed it. I needed to take just a few minutes for me. I don't know if you guys follow Kylie Kelsey's podcast. She's obviously a Philly mom, but she recently did an episode on, I don't need me time. No one else needs me time. And I wanted to sing out loud when she said that, because I think that's not just how I feel as a mom. It's how I feel as a program director sometimes. And as an emergency physician, if we're tying it back, like you have those crazy shifts where you're just like, No interruptions. No one talked to me. I want to eat my granola bar without my Vocera going off and someone trying to talk to me. So it's almost like being an EM doc and being a mom prepared me for each other, if that makes any sense. Oh, I remembered the other thing. I knew that would happen.
Go
Yes,
for
go
it.
ahead.
Lay it on us.
So the other thing was like how this left turn changed me. It has made me such a better doctor to be a parent. I feel like I have so much more empathy for both sides, whether it's someone's parent who is ill, whether it's someone's child. Like when you go through things, right, you can truly find empathy. So, like, first time parents where the baby won't stop crying, but the baby's totally fine. Been there, understood what it was like to have to hand the child off because you were like, I can't do it anymore. And I just think that going through things, whether it's loss or joy, really enables you to connect with your patients more and just have true empathy. So that was the other thing I was thinking about earlier.
To be able to have that nobody needs me moment is really just a rarity. And it is such a like crystallizing moment rarity. And so that is what is rolling through my mind sitting over here listening to you is just, yes, please say more.
Yeah, it's funny. One other thing that I've really learned to help with like longevity and getting through moments like this is to have other women friends that are in emergency medicine. Like I do have friends outside of medicine, but there's something about when people understand, like truly understand, they've done it, they've been there. You can just send one single text and the whole group piles on with, oh my God, I know that. It's just,
Yes.
I'm trying to think what the word is, but just the solidarity of people who understand. And I certainly have friends in other medical specialties and they go through similar things in other capacities. But if I try to tell them about my day, every single person I know in another specialty thinks I'm crazy. They don't know how we do it. And personally, I don't know how family docs do it. They are incredibly over, and I don't know how surgeons do it. But I just think it's so telling to me when our department chair of surgery is a woman. And we went out to dinner with some of the other, like the OB chair. There's a lot of women in leadership in my hospital, which I'm so incredibly grateful for. But to go out to dinner with them and hear them like talk about things and ask me a question and I look at them and then all of a sudden they're just like, why do you do that? Like, how do you do that? Why do you do that? Yeah, why do we do this? I do it for the patients. I love this job, but having solidarity and people who understand is so important. And that was another thing that I learned, that you can't do this by yourself. You have to do it in a group setting.
It's so funny because the last time Molly and I saw each other, we actually gave a joint lecture on this exact topic at the Women in Medicine Summit in Chicago. So shout out to Women in Medicine. Woo! You need your rest. And she come talk with us next time.
Yeah.
Sign me up. You know what? Because then I can go to my hotel room and have time after the lecture where no one needs me.
There's a very large portion of the talk that talks about wine and wine with or without the H in that
Yes.
word.
This is the question that I've been wanting to ask. And as a little background, Megan and I don't actually know each other, despite the fact that we live in the same city and have many mutual acquaintances. But I've also told this to Molly and I've told this to Megan separately since we're social media friends, that I don't think we can work in the same building because the hospital might literally catch on fire, and not figuratively. So do you actually find coverage for your shifts? Is it the shifts or is it you that's the black cloud?
Historically, I thought it was me. I actually, during the pandemic, I put together this talk about owning being a black cloud and like second victim syndrome and like how you get to that point. But then I was just like, you know what? This whole place is a dumpster fire, whether I'm here or not. But legitimately, sometimes I walk in and like someone will collapse. Like it's just insane. I actually have a black cloud tattoo. So I have fully embraced it. It's just a reminder during the day that like I've got this. Like I have probably seen worse. I've probably seen more. So you'll love this, right? I mentioned earlier, before we started recording, that yesterday was a crazy day at work. There were like 7 stroke alerts and a code all in about an hour and a half. Then I was like with one of the code strokes, like right outside the CT scanner waiting. And the CT tech opens the door and she's like, code blue. And I'm like, I got this. And
You just like super cash stroll into the CT scanner, intubate somebody in the donut. Like,
Good.
what?
And the CT tech after was just kind of like, "You're so calm." I was like, "What's the point in yelling?" Yeah, it's so funny because when you work with, I feel so old saying this, but like new attendings or new residents or people from other subspecialties.
Kids
I
these days.
These days. And you see them like stressed and then they like, oh, this was something that happened the other day too, was like a young female resident like was feeling very stressed and lashed out at the nurses. And you're just like, come with me. It's the land of old lady talk where we're gonna talk about how women are leaders and don't take your insecurities out on the nurses. But yeah, it's interesting how you go through so many cycles, I think, in this specialty of just like panic, and then you're kind of like resigned. And now you're like, everyone watch me. I got it. Let me show you how to do this calmly and collectively. And then afterwards be like in the car in the parking lot, like, I'm so tired. Everything happens all the time.
I do love the dichotomy of moments. Literally in the same shift on Saturday night, I had a moment of where I explained to a resident, an off-service resident, like a consulting off-service resident, just because we do not respond the way that you think we should respond to an emergency does not mean we are not as equally concerned about the patient as you are. Moment one. About 2 hours later, I got into a yelling match with a drunk patient, so not the most professional moment of my life.
We've
So,
been there.
so
There.
the dichotomy is real.
And people wonder why we're tired, right? And we don't want to make decisions after work. We talked about this earlier. Like it's your whiplash all day long. It's just such a roller coaster.
It was really okay. We're gonna bring this back around. Okay, so
If we must.
here we go. Looking at your life lessons, now let us fast forward and hone in on your role as program director, because that is an extremely unique area leadership role to hold. Because not only are you responsible for growing these adults into professionals, but somehow you've got to tread this line between adulting them as well. How have you managed to strike a balance in slash not strike a balance, but be in the pursuit of balance in passing along some of the life lessons that you have learned along the way to your residents?
That's I wish I could say I'm doing a great job. Some days I feel like I'm nailing it. Some days I feel like I'm totally flunking out at it. But I think that one of the things that a resident thanked me for was not just being honest, but being vulnerable with them and sharing history, whether it's personal, whether it's professional, what I did in a case or how I managed it or how I'm feeling just emotionally in the world. And they have been able to see me a little bit more as a person instead of just an administrator. But I have to say, it's hard. I think my first year, I swung to this like pendulum of, oh, I'm going to do everything because I want them to like me and we're going to have a great program, but they might not agree with anything I say, but they're going to like me. And then they liked me and then they weren't working very hard. So then it was like, okay, now I have to kind of be mean. And it's just really interesting. I think there's no great answer for that other than being honest and open and vulnerable and leading by example. The same way you do in the department with your team, I think you just have to just lead with example, be professional, give examples. The one thing that I try so hard to never do is say when I was a resident, because I remember feeling, oh, shut up. When people would say that to me. I think it all the time. And I do say it sometimes, but I feel bad because life is different now. The learning styles, there's so many distractions. And I'm guilty because I do say it. I think it every day, multiple times a day, but I try really hard not to do that. When I was a resident, I worked 6 trillion hours and there were no work hours. And I had to walk uphill both ways with my dance goes and sleep in the hospital during a hurricane, even though I did do those things.
Even though things are really different in terms of residency training these days, and even medicine, all of us are pre-pandemic trainees. So we've never had our educations interrupted with changes to the curriculum, with changes to patient care, with a global pandemic affecting the way that everyday medicine is practiced. What's been one of the most important lessons that you've learned about how to navigate in a very different world than what you started in?
Oh my God. There's so many layers to that question, Liz. I feel like I need to meet with my therapist first, and then I'll get back to you about how I should answer that question.
Meet with us post shift for some wine, and then we'll talk.
Yeah, yeah. I feel like, there's certainly, there's the political climate, there's the clinical environment of hospitals closing and increased burden to physicians since COVID. There's the educational differences, which I think I'll just stay steady and focus on that. I think obviously emergency medicine, right? We had all these applications, we had no applications. And then we had applications with different types of candidates. Medical schools changed the way they were teaching, the switch to like digital asynchronous education and pass fail, and all of this has definitely changed how we have to approach teaching residents and setting expectations for their learning. I wish I had a good answer for how I've done it and been successful. I think we're trying a lot of different ways to get residents back into a studying. I am an employee, but I am also a student, and I have three different jobs, right? I'm a human, I'm a student, and I'm an employee. And to get back into that, it's so hard. The biggest thing that I think I've noticed is there are too many options for them. And many of them don't know how to study with, do I do this podcast? Do I read this book? Do I just do questions? What do I do? And medical schools have focused so much on boards and exams. And so they feel like questions are how they're going to learn. I learn best through questions. No one learns best through questions. No one learns best through questions. Questions are to test your knowledge, not to learn from. And
Preach.
that's been a
Yes.
huge barrier to changing mindset in education. And some people they're gonna be like, you're prying it from my cold dead hands. And I'm like, please let me just replace it with tints and Allens, please. Like, I'll even give you like the little version. Like, please.
Mini tint. I'll give you mini tints.
Let me just like you're like pulling something out, like, oh, like Indiana Jones, right? Where he's like replacing the thing and you don't want the boulder to come down. Recently on shift, I had this discussion with a resident about doing a CTGI bleed for variceal bleed. And I was like, what are we even talking about right now? What are we talking about? And they're like, some people say you could. I'm like, but let's open a book. And I felt like I was an 800-year-old teaching. Like, I remember by attending me like, let's go to the books on shift. And I resented them. But I was like, seriously, like, where are you even getting this information? That's the right next thing to do. And then he showed me the website. And I was like, okay, it's there, but that's wrong.
I completely agree with all of that. It's the perpetual conundrum of you are technically correct, but also no.
But really, no. I think that's the thing that's going to make our jobs infinitely harder, especially for you two, but in general in medicine over the next decades is misinformation, incorrect information, and too many sources. For all of our students who have been listening to this, textbooks are good. Keep your first aid. You're going to want it someday, even for sentimental reasons.
Books are good, kids. Read them.
So, Megan, as we bring this conversation to a close, which we are both very sad about, this has been wonderful and we need to do this more often. If you could look back at your intern self, knowing everything that you know now, having gone through the different steps that you have gone through, and giving yourself a piece of advice, what would it be?
Oh my gosh, a few things flashed through my head. One was be outside more.
Love that.
Be outside more. Be outside whenever you can. It's so important to get fresh air and sunshine and be out in the world. Study outside, read outside, just be outside. And that's something I think I've learned now. The other is don't disconnect from friends and relationships. Really, if you have a little bit of time, cultivate those friendships, whether it's co-residents, it's family members, like just having relationships is so important, and medicine will be there. But when you have a tough day, you need to have your support system. And it's really easy to get caught up in yourself and your emotions and your stress and push people away. So be outside, cultivate relationships, and just try not to lose yourself. Try to remember that Long days will happen, long weeks, long months will happen, sometimes long 3 months will happen. But what makes you is really important. So you like to knit, you like to run, try to run. You like to collect 600 cats, that's weird, but do your thing. Just don't forget who you are. And you are not medicine. You are more than that. And I just think that those are things that I struggled with, but things that I've come around to appreciate and learn.
You are more than medicine. I don't think we could have said it better ourselves. Thank you so much for joining us today, for taking time out of your busy schedule, for taking hopefully a moment for yourself, but also for us. We really appreciate it.
My pleasure. Next time I want to do the wine and wine with you guys.
Done.
Absolutely.
Thanks, guys.
Thank you. And we'll catch the rest of you on the next episode of the Women's Wisdom Podcast.
We hope you have enjoyed this podcast from the American Academy of Emergency Medicine. AAEM is a nonprofit professional association of over 8,000 emergency physicians dedicated to board certification and democratic group practice. For more information about AAEM, visit our website at www.aaem.org.